Welcome. I'm Jody Hurwitz, President-elect of Heart Rhythm Society, and this is Advocacy in Action. Today, quite wonderfully, we have Anne Marie Smith, who's Vice President of Practice Improvement, and Lisa Miller, who's Senior Director of Health Policy and Reimbursement. Anne Marie has been here for 6 years with us, and she was a consultant for us before. Lisa Miller may only have been here for about a year, but this is her second go-around, and previously she was here for 4 years. Today, I think what we're going to do is ask them what they do for HRS and what's going on in their daily lives. So, Anne Marie, welcome.
Thank you so much, Jody. Thank you for having us. Well, first of all, health policy is part of our practice improvement department that focuses not only on health policy, but also on reimbursement and regulatory affairs, as well as quality of care and value of care. Now, as everyone knows, the excessive and unsustainable ablation reimbursement cuts imposed by CMS have been our prime focus in the past year and a half. Ultimately, these cuts are going to adversely affect the care and outcomes for our patients, especially those who are most vulnerable and underserved. So that falls directly under our practice improvement, quality and value principles. So HRS is employing a multifaceted strategy with a focus on 5 areas to address and impact the forces and policies that are causing harm to the heart rhythm profession. These are regulatory advocacy, and reimbursement is part of that, legislative lobbying, education, communications, and collaborations. And I'm going to turn to Lisa to talk more about what that entails.
Thank you, Anne Marie. As Jody mentioned, I am the Senior Director of Health Policy and Reimbursement in the Heart Rhythm Society's Practice Improvement Department. My primary focus is tracking and analyzing healthcare reforms and policy changes related to coding and payment, service delivery, safety, and patient access to determine the impact and whether there's an opportunity for improvement or a threat of some sort, and if so, to what extent. Usually when a regulation is published by a federal agency, we use a 2-pronged approach for review. First, staff will synthesize the issue from a policy perspective, looking at the pros and cons, and then the issue is vetted through our Health Policy and Regulatory Affairs Committee to assess the impact from the practicing physician's perspective, and then to solicit input on development of a public response. And then from there, we will develop an advocacy strategy, which usually starts with a comment letter. If we're unable to influence policy decisions through written comments, then we will explore alternative approaches to engage directly with federal agencies to promote the Heart Rhythm Society's priorities and goals. That could be a conference call, it could be a face-to-face meeting, or it could be some type of collaborative stakeholder activity with the broader medical community. And we believe that it's important to engage members in these processes at the onset because it's easier to influence policy decisions before they're implemented instead of retroactively after they're finalized. As Anne Marie mentioned, this year, in response to Medicare physician fee schedule changes for 2023, the Heart Rhythm Society did initiate an aggressive grassroots and grass tops campaign to advocate against payment cuts for ablation procedures. And we will continue to seek out those types of opportunities to enable members to communicate directly with CMS, other federal agencies, and members of Congress. In addition to these advocacy efforts, we also work very closely with the American Medical Association, the American College of Cardiology, and our industry partners on CPT code change proposals, particularly when there's a request to create new codes or delete codes or modify existing codes. And we also administer a survey to collect data to recommend relative values to the Relative Value Update Committee, referred to as the RUC, and that's for rate setting purposes in the annual Medicare physician fee schedule. I also work very closely with our Health Policy and Regulatory Affairs Committee. This year, the committee is developing a series of webinars to educate membership on a variety of issues related to the health policy landscape. We hope that you will be able to join us. Our first session will start in February, and it will focus on the CPT and RUC process and why it's important to have a seat at the table, and also to provide some insight into how the Heart Rhythm Society advocates for payment changes.
Thank you very much. It sounds like you two are involved in an awful lot. I can tell you personally, I've been involved in lots and lots of different meetings that the two of you are deeply involved with. I think one of the things that I would stress, that you also stressed, Lisa, is involvement of our membership. I think that everybody really needs to get a little bit more involved and opinionated. I know that the two of you seem to be pretty easy to get a hold of. So if anybody has any questions, I'm sure you all wouldn't mind if they get involved with that. And I would tell everybody out there, remember, if you hear from these women, please respond, because they're asking for your opinion, and your opinion counts. Thank you very much. This has been great. Stay tuned for our next session, where we will ask them what's going on in the future. Thank you.